Thanks for coming to our every other week Capital Chat. I'm Brooke Lovelace, the Executive Director of the Iowa Developmental Disabilities Council. Just a couple of housekeeping things. We should have an interpreter that is pinned for you. And there's also a closed captioning option down below. If you hit the three little dots that say more, that should pull up our closed captioning. We're glad that you guys are here with us today. And with that, I think I'm turning it over to Amy to kick us off.
Yep. Good morning, everyone. And I'm Amy Campbell. I work with the Iowa DD Council on policy issues. And as you can see here, I have a countdown started for how many days are left in the legislative session. These are actual physical days, not necessarily working days. So since legislators only work half the week, Tuesdays through Thursdays, mainly, you can subtract about half of that, and that's how many working days we have left. So about 23 to 25 actual working days left before they lose their reimbursement for expenses. So that's kind of the trigger of when the 100 days is done. So just a reminder where we're at on this next slide, and all of these are posted on our website so that you have them. We're approaching the second deadline, which is called a funnel, on March 20th. And so, as you can see, we're somewhere in that process between the first funnel and the second funnel, which is really a lot of debating on the floor to move bills over to the other chamber. So, they have to go through committee in one chamber and then go through it in the other one. So that's where we're at. So you'll start to see next week, we'll have a mix of subcommittee meetings and committee meetings and floor debate as they start to get ready for this next deadline. Anything that doesn't make it out of committee in the second chamber, so if it's a House bill getting out of the Senate committee, if it's not out of committee by March 20th, it's dead. Budgets and tax bills are exempt from that, though. So just a reminder, we're now coming up on another deadline. So if your bill that you're watching hasn't been voted on yet, it's starting to get to that crunch time if we're going to make it move. So again, we have our bill tracker that is updated regularly. It's online and at this link on the website. But I just wanted to focus on the bills that have been moving and had some action since the last time we met. The first one is Representative Engel's bill that allows Iowa tuition grants to be used for the comprehensive transition post-secondary programs like UI Reach is the one we mentioned a lot. That passed out of the House 96-0. And it is now over in the Senate Education Committee. So that's well on its way. It doesn't have a subcommittee assigned yet since this just happened. So that will need to happen, a subcommittee meeting, and then the committee vote on it before the 20th deadline. The other bill, I think we noted this in our report last week, House File 2292, which doubles the number of beds at the MHIs. It requires, doesn't allow, but requires doubling the number of beds at the state MHIs, and then allows the department to ask for a waiver to use Medicaid to fund services there, which will help save some money, state money. The House passed that 90-0, and it is now over in the Senate HHS committee, and that is the legislators that are assigned to that subcommittee. We know that that's going to cost a lot infrastructure wise. So that's probably why you see Senator Warmy and Senator Costello on that committee, because they are the chair and vice chair of the budget subcommittee as well. I wanted to make note of House File 2501, which passed the Senate 44-0 and is back in the House with an amendment. So it's already passed the House, went over to the Senate. The House added something to this bill that was concerning. Before, it was just a non-controversial update of election laws. The county auditors had worked with the Secretary of State on that. But the House eliminated the option that allows a person who's a voter in a district to attest on a form that a person is eligible to vote in that district. So, for instance, if I went to the election to the polls to vote with my husband, and my husband lost his ID and couldn't find it, I could sign a form attesting, basically swearing that my husband is indeed who he is and that he's allowed, lives in the district and is allowed to vote. That would remove that option. So the Senate took that out and sent it back to the House. So that if the House accepts that amendment, it'll go back to being something we're not really concerned about. But I just wanted to make that note because I know sometimes people may misplace their IDs and not have the proper identification to be able to vote. House File 2518, we've been watching. It requires Medicaid to set up a regular rate review for home and community-based services providers. They are currently not, they don't have their rates reviewed. So legislators kind of just come in every once in a while and increase it, but don't really have a review that would look at their costs and whether their costs are going up and should rates go up. HHS wants that every 4 years. I think most provider groups were asking for 2 years. But when I talked to Representative Meyer, she said, well, let's start with 4 and then let's work on getting it to 2 in coming years. She basically said that's the only way HHS would be willing to do it is if it's every 4 years. So, so just keep that in mind. She knows that people will be coming back in future years and asking for it to be more every 2 years. That's passed. There's a subcommittee meeting on Tuesday, March 10th. And if you go online to get these slides, that is linked to the Zoom for that meeting. Since this is in the Senate, you can not only watch, but you can also make a comment online as well, public comment. So they'll usually go around the room in the subcommittee and then ask for people in the room to make comments, and then they'll go online, and if people want to make a comment online, they can. House File 2523 is a bill that allows somebody to directly commit their minor child without a court order to an MHI. That passed 70-21 and is now over in the Senate. And they have not yet assigned a subcommittee, or they passed the subcommittee. So it just needs to go to the full Senate full Senate committee, HHS committee, for a vote. Kind of moving still on House files. There's a lot more House files than Senate files. House File 2538. Just wanted to make note of that. Has a whole bunch of changes to education, but one thing they added is allowing a teacher to request a meeting with a student's IEP team at any time, and requires there to be a reason that request be denied. That the House plans to debate that bill on Monday. It's on the calendar, and Representative Skylar Wheeler is the floor manager on that. House File 2543, some people I know have been watching this after the interim committee on subacute mental health care met. This is kind of a bill that addresses a lot of the barriers that were brought up during that interim, and that passed 89-0. And since it had a Senate companion, so an identical bill that had come out of committee over there, they know it doesn't have to go through committee again. It is going directly to the floor. So it is safe from the funnel. House File 2585 is the bill that would allow or require pharmacies to have an accessible prescription label or information option that's available free of charge to people upon request. That is a bill that has been closely watched by us and AARP and other organizations. And that is on the House debate calendar as well for Monday. So it is on its moving. Wanted to bring up a new bill that has come up, House Study Bill 759. This creates a pilot program to refurbish and recondition durable medical equipment for Medicaid participants. So they would take used or older medical equipment and fix them, update them, and then give them for free to Medicaid individuals on the Medicaid program. That is a bill that has been requested by Easter Seals. So they also have a subcommittee meeting on Monday at 12:45. And again, that is linked in the PDF document on our website. I don't know if you had anything more, Carlin. I know you had a discussion with Easter Seals about it.
Nope, you said what I know, so.
Yep, so that is on the House side. Moving over to the Senate side, and I only have one screen on this because they have fewer bills. I spot probably because there's fewer senators. But Senate File 2404, I know people have been watching. It establishes a pilot program that allows one rural and one urban district to set up separate schools for special education students or students with challenging behaviors. That is on the Senate calendar, and this week they filed a fiscal note on it, which said that it would cost between $1.2 and $4.6 million. That it was a big range. The smaller rural school we found out would be Winterset, and it was only about $170,000, and the remainder would go to an urban school. And I found 12. Somebody else had said 13 would qualify, but it's the bigger schools, the districts that you would think about when you think statewide. Senate File 2417 is moving quickly. It went directly out of the Senate and onto the House calendar because, again, it had a twin bill, a bill that was a companion. And that basically sets up some standards for chatbots. They can't pretend to be therapists. They have to notify somebody they're not a human. And they have to make sure that these chatbots don't encourage self-harm or violence. So we've heard some pretty strong cases where people were told how to commit suicide when asked by a chatbot. And also the Senate was very concerned about new companion chatbots and how people are having relationships with chatbots. So that is something that they wanted to make sure had some guardrails around it. Senate File 2461 is one that you might think, why is this on the list? But automatically enacts a status quo budget. So the same budget as the previous year if the legislature can't pass a budget by July 1. So you've heard about federal continuing resolutions. This would be kind of a similar thing where it would be the legislature wouldn't have to take action. You would just continue with the same budget. However, we all know programs like Medicaid don't have the same, even to stay status quo, it's not the same appropriation. It's always more money each year just to do the same thing. So if they pass a bill that says it's the same amount the next year, that's inevitably going to be a cut to programs like Medicaid or school aid or some of those other programs that go up every year. Prisons. So I don't know how, I don't think people have really thought about that. Interestingly, I've heard some people have said that this is a way to not have to negotiate with a potential Democratic governor. I also heard yesterday that it's the Senate can't even negotiate with themselves internally because of conflicts that they have with like carbon pipeline and other things. So I don't know what if this has a future in the House, but I wanted to call it to people's attention that it might be problematic for programs like Medicaid. Senate File 2422 is the Senate's version of public assistance reform, which we talked a lot about last week, our last Capitol chat and in our updates. The Senate's one is the one that says you can't get out of Medicaid managed care unless the legislature does it. So that has been deeply concerning to people. And it also says that you can't apply for any waivers, including home and community-based services waivers, if they can't prove that it's cost neutral. That has passed the Senate. It was I think it was a party line vote. There might have been one Republican senator that voted against it. The House has set a subcommittee meeting for Tuesday, March 10th at 8 a.m. In the House, however, you cannot speak online. You can watch it. So anybody can follow that link and go ahead and watch the subcommittee. If you want to speak, you have to be present at the Capitol to speak. So there will be plenty of people speaking at it. But for those that may want to watch it, you can and hear what others say about it, you can follow that link to it. So I'm going to pause there and I'm going to turn it over to Carlin for an data. Oh, go ahead.
Just a couple notes on your last slide. So the 2404, the education bill that would establish the 2 attendance centers. Just one note on that is that the funding for that is coming out of the AEAs. So that's another bit of a maybe a cut to AEA budgets, is that they would have to fund that pilot project. And the public assistance reform, we're going to come back to that on the next slide. But just to clarify what Amy was saying about applying for waivers, I don't want it to be confusing. That means that the state is limited in applying for waivers from the federal government to make changes to HCBS programs. So a change to a program would have to be cost neutral or save the state money. It could not be something that would cost more money. And sometimes new programs cost money initially and save money in the long run. So it's really limiting the state's ability potentially to be innovative, which we can move on to a little bit more discussion about 2422, which it has passed the Senate and is now in the House. And as Amy said, the subcommittee is Tuesday morning. And we're encouraging people who may not think it's a good idea to have managed care as our primary source of Medicaid distribution to show up and speak up if you can. This bill would lock Iowa into having to use Medicaid or managed care for Medicaid, except for the fee-for-service programs that are already in place or will be in place by January 1st of next year. And that includes HIP. We've gotten a lot of questions about HIP, and HIP has included that it will maintain as a fee-for-service program, but any new fee-for-service programs could not be added after January 1st. And it's even concerning that that is listed in the bill, even though we know that, and the state knows that, and the legislature knows that fee-for-service programs save the state money. So that's why they're kind of being grandfathered in. But the reason that locking the state into managed care might not be such a good idea is that if there were new programs that were to emerge that could save the state money, that would not need an MCO and would deliver Medicare services and supports, they could not be implemented. So it's a concerning bill. We are, again, encouraging people to show up to the subcommittee or send in your comments. And the subcommittee is chaired by Representative Austin Harris. This is on the House side. It's going through the House subcommittee now. And Representative Harris is the author of House File 2716, which is the House version of this bill. So I think, he's going to be listening closely to concerns on both bills, because these bills will probably merge at some point, or they're going to have to go through each of them and figure out the good, the bad, and the ugly, and what to pass. And they may pass versions of each one, but they're both concerning in different ways. To go into the 2716, a little bit more. This is the bill that includes the Medicaid for employed persons with disabilities changes or an update. And that's the kind of work without worry language that we've been working on for the past couple of years. It makes a very slight, small change to MEPD that takes us a step forward in what the Work Without Worry bill was trying to accomplish, which was to eliminate income and asset limits for people on MEPD so that they can earn and save as much as they want. What the change is that it changes the eligibility from income, an income limit of 250% to 300%. And that equals about $7,000. So it's a slight change, but we want so much more. Of course, we want more. Or we'd like to see more because it would make a bigger impact for more people who need this program. And it might help move some people who are in traditional Medicaid onto MEPD because they can work more and earn more. And we know that that saves the program money in the long run and saves the state money in the long run. It's a pro employment bill. Work Without Worry is, and this is kind of making a small Medicaid change and not so much a pro employment movement. So those are the two bills that we've been watching very closely and trying to gather comments from advocates, from providers, for to be able to again and send your comments in too, so that they hear what you think and where you want these things to go. And Senate File 2315 does the same thing that the MEPD changes do in 2716, but it's a standalone bill. So, again, it's a step in the right direction. It's a small step. The concern is the cost. And I know this bill is still in the Senate, and they are very carefully looking at the costs and how to trim that down, because it's projected to cost $2.6 million to implement in the first year. And that would primarily be people who have applied for MEPD and been denied because they earn too much. So once again, cost is the concern. So we have outlined it in our bill of the week, and that's posted or will be soon on our website. Just wanted to make mention too of an advocacy day coming up on April 1st. This is basically a day on the Hill for people with disabilities and organizations. There'll be several organizations there tabling and with materials, and the focus is on Medicaid, just education about what Medicaid funds, why it's important, and why cutting it is not a good idea. So that's what we will be working with with our advocates on messaging, and hope you can join. It's from 9 to 2, and there will be educational sessions in the morning, legislators also talking to advocates, and then lunch is provided by a restaurant in town that hires people with disabilities to work for them. So we'll get to highlight that restaurant and also those employees and taste their delicious food. I hear it's very delicious. And we'll have time to talk to legislators too. So hope you can sign up. I'm going to put the sign up in the chat.
Yeah, I was going to add, so Senate File 2315 came out of appropriations, so it should be funnel proof. So that bill doesn't necessarily have to get voted on really quickly, but it would be smart if it did. But I also have heard a rumor, and I don't know that this is true, that instead of passing House File 2716, the House may, during the subcommittee on Senate File 2422, may amend their their bill into it, like strike the Senate bill and add in their stuff. I don't know that that's true, but it might be a way to make sure that that gets through the funnel rather than sending the House bill over to the Senate. So it just makes it faster. And then they can negotiate both bills at the same time. So that's what I've heard. I don't know that it's a decision that's made yet, but both of these are set pretty closely to survive the next deadline. I don't think we have any more other than Carlin, were you doing your mini training today after?
Yeah, there's a mini training today and next Friday too. We'll just talk about messaging when you're coming to the Capitol to talk to your legislators, and we also talk about just what to expect when you come to the Capitol, which doors to come in, you know, the basics up to how to talk to your legislator and how to talk about what's important to you and what you want. So feel free to join. It's quick and fast and easy.
Yeah. And then I was also going to just say, and we'll open up, I know we're short on time, a lot on here. Next week will be pretty telling. The revenue estimating conference meets, so that means we'll know our budget numbers. That's what the report that they come out with on Thursday will decide how much the state can spend for the next year. Also important is Friday the 13th is the day that legislative candidates file their papers. So if they want to run for office or run again, they have to file those papers by the end of the day, Friday. So we've had a lot of people walking into the Capitol doing theirs already, but that's kind of when legislators know if they have an opponent. And it often becomes a quick push to try to get session done quickly because that June primary comes up pretty quick. And then, of course, we already talked about the April Disability Partners Day. But our next Capitol chat will be on the funnel deadline. So we will be able to talk about which bills made it, which bills didn't. And yep, that'll be, I have no forecast on that yet. It's hard to get an idea of what's going to actually pass or not right now. So 3 minutes left. Questions? We put in the chat those links to things, but also this weekend's report, written a report, that will be sent out by email and then also posted on our website. We'll have those links in it too. We'll make sure we have those for the comment links for the Zoom links. So check your inbox. Also want to remind people they can send emails to their legislators through our Take Action Center on the website. We have a Let Us Work campaign running right now that you can use. You can always send it directly to your legislators. This is just nice for people that don't know who their legislators are or don't want to look up what their emails are. So, do you have any questions in the chat? The mini training link is in there if you guys want to stick around. Talk messaging. All right. Well, thanks everybody. Appreciate everybody joining us today on a rainy day. I'm ready for the April showers and May flowers already. All right. Thanks, guys. Thanks to our interpreter for sticking with us here. Thanks, Jeff.
Thanks, everyone.
Bye-bye.
Have a great weekend.